Let me know when both of them start. Just give me a thumbs up. Ready to go? Hi everyone, Dr. Rich Castellano, the Smile Doctor. We're here today with Gail. Thank you, Gail, for letting me share your video today. We're going to be doing some of the Sculptra under the eyes, and so, but we got to brag on you because she looks so good. Her pictures from her lip, if you can take a look here, we did the lip, the neck, and the jawline, and what a tremendous improvement in the neck and the profile. Really pleased with her results, and then we're going to do a little bit more for under the eyes just to build in the cheeks, so we'll look straight in at here. So tell me, how are your thoughts on the lip so far?
Oh, tremendous. Yeah, big improvement.
The comments from family or friends?
A lot, yep. My family really can't believe the difference, yeah.
So proud and so happy that you like it. So with the Sculptra, that's a collagen stimulator. We're going to do a little numbing medicine. And so hold this for me, Gail. Let me show you the areas we're going to focus on. For the physicians and students that are watching, I like to use my white pencil to mark out the area. So traditionally with the Sculptra, here's where we focus in the cheek. And down through this area here. Make a big smile for me. See how that plumps the cheek? That's our model of what looks good. That's what we're going to focus on. So any other areas that you wanted to address with the Sculptra?
I'm just wondering, does it take some of this off?
So it's a good question. So when you build the collagen with Sculptra there, it does soften it a little bit, but every time we smile, we're incorporating so many muscles, we're recruiting so many muscles that you're always going to see some creases.
Sure.
Laser can help some, and then Botox helps with the suspicious squinting, but when we go big, you're always going to have some creases. So we just have to keep in mind, of course, that we never see ourselves the same way that other people see us. So I'll build as much collagen as I can through this area, and then there's no restrictions after the Sculptra. 5-minute massage 5 times a day for 5 days, and then we'll check in again in another couple of months to put your before and after side by side. Any questions?
No.
Very good. So for my physicians and students that are watching, we've already mixed the Sculptra. We mixed that ahead of time. And I like to mix it again one more time right before I inject, because it can settle a little bit. So I like to use Hibit Cleanse and alcohol for cleansing on the skin. It's very rare that someone's going to get an infection. I'm going to have you rest your head all the way back. And with the Sculptra, it's gradual, so you'll see results straight away, but then that fades over time. And of course, we always pay attention to our ABCs of plastic surgery. When you know the ABCs, you always make your best choices. A stands for area. There's 4 areas we address to improve the facial appearance. If we sag, we tighten. Now buzz and pinch here, so you feel buzz. Pinch on 3, 1, 2, 3, pinch. You feel small, medium, big pinch there?
Medium.
Medium, okay, so we'll give that a little break. How about now? Do you feel any pain?
No, just a little stinging.
A little stinging, and that fades away. Buzz, pinch on 3, 1, 2, 3, pinch. Okay, let's take a little break. You doing okay?
Yeah.
So that's pretty much the worst of it with Sculptra when we're building in the cheeks. Now, the cannula that we use is a soft tip cannula. So I make a little insertion point in the skin. Do you feel a little pinch here?
Yes.
Small, medium, big?
Medium.
Medium pinch, okay. How about over here? Small, medium, big pinch? Not too bad?
Not bad.
And lidocaine takes effect pretty quickly. So I'll give it just one more mix. I'll put a little air bubble in there, get the air bubble all the way to the top, then mix it around. And just a couple of little shakes to get it down where you need it to be. And then it feels numb and goofy under the eye after we add the filler. I'm going to turn your head to the side a little bit. So I use twist technique. You feel a little pressure pinch there? A little pressure pinch. We go slowly. I use the shiver technique to put a small amount of filler over a large area. How about here? Small, medium, big pinch. Not too bad?
Medium, not too bad.
Little pinch there. So there's some numbing medicine throughout the area that we're injecting. I just go real slow. This is a subcutaneous injection. This is an advanced injection, so if you're not comfortable under the eye, that is something that does take thousands of hours of practice to really get down and do safely and correctly. Everything's looking good. You doing okay, Gail?
Yep.
How about here? Small, medium, big pinch?
Just a little bit.
Okay, so we're done for that side just for now, and then it's very normal if Gail feels a little bit numb and goofy. So again, I bring in that little air bubble to the top and then back to the bottom. Preserve every little tiny drop of that Sculptra. Same thing over here. So the cannula is now subcutaneous. Twist, twist, twist. I feel a little bit of a pinch there. Pressure pinch, sorry, a little bit of numbing. So I mix in extra lidocaine with the Sculptra to make it feel a little more comfortable. Our goal is that you feel either nothing or little tiny pinches that are tolerable, and then you'll feel nothing. And if patients need a break, we take a break, but usually patients say, that's fine, keep going, I'm all right. Again, for my physicians and students, if patients ever feel lightheaded, that's called the vasovagal response, and the right action is to lay the patient down flat so that the blood can flow to their brain. How you doing? You doing okay?
Good.
You feel a little bit of numb under here?
Yes.
So back to the ABCs of plastic surgery. A stands for area. There's 4 areas we address to improve the facial appearance. If we sag and tighten, if we lose volume, we fill. Sun damage, wrinkles, and sunspots to the skin, we can polish and repair the skin. The 4th area is better than everything else, and that's our behavior. Nothing looks as good as our smile, and Gail has her smile down. She's a good smiler, and that's the best part of what we do as the people we get to work with. So the smile always shows us what looks best in our face. So I'm seeding that cannula, subcutaneous. You feel a little pressure pinch there, or just pressure?
Just a little pressure.
So that's A for area, 4 areas we address. B stands for boundaries. What are the rules for good plastic surgery? Safety is always first. You must look natural. Let's prevent future aging and let's get as much improvement as possible. We can't make things perfect. We're not God. We do the best we can. And if we need to come back another day and do more, that's better than going too far. Everything's looking good. There's no restrictions afterwards. I like to do that 5-minute massage 5 times a day for 5 days. So B stands for boundaries. C stands for combination treatment. If we want our best results, we combine. We combine tightening, volume, and skin to get the best overall results. Best results, no downtime. Or best result with just one treatment is lifting. Best result, no downtime, is filler. Let me turn your head this way. Now fillers, they do a great job, but they don't give us a lift. Lifting, I get wonderful results, but I can do even better when I combine. So if you understand those 3 categories, you'll know what is right for you and you will not go too far. But of course it is important that you have the right artist taking care of you. So I'm tapping, feeling, massaging as I'm injecting. This is right anterior to the inferior orbital rim. And injecting right in the nasolabial groove and even in the preceptal area. I do think you get your best result when you're injecting below the orbicularis oculi, preceptal. Okay. Again, one more little mix. So as you can see, Sculptra is a pretty simple injection. No downtime, great results, and it is gradual. Now D, we went through A for area, B for boundary, C for combination. D stands for different perspective. And of course we never see ourselves the same way that other people see us, even though we're looking at the same thing, because when we look at other people, we look at them socially. When we look at ourselves in the mirror, we do not look socially. We look seriously, and we look for imperfections and can be hard on ourselves. This is the reason people go too far if we're too hard on ourselves. In fact, I just had a patient tell me right now, she says, I don't want to be too hard on myself, I don't want to go too far. I'm relying on your professional expertise to to guide me, which is of course what we'll do, but I do need to hear where your focus is to get the best treatment plan and the best results. So it is a combined decision. And I'll do a little bit submalar. Everything's looking good. My team has everything set up perfectly for me. Thank you, Quinn. Quinn's our camera person too. I feel a lot of love in the office every day. My team takes great care of me. They'll take great care of you as well. So Gail, what was it that inspired you to have a cosmetic treatment then?
Well, I went to your seminar and I just love the after pictures, and I always wanted to have it done and just never, I guess, was brave enough to do it. And then I found you, and I had a lot of trust in your work, and that's what did it. So
Very good. Very honored.
needed to find the right person that I could trust.
We're very honored to be a part of this journey with you, and you had a chance to talk to our patients that had treatments done.
Yes, I did.
And the book, did you get a chance to look
I
at the
did.
book?
I read the whole book.
Was that helpful?
Very much. Yes.
Okay, good. Very good. So we've made all the resources available for you.
Yes.
Last little bit here. So again, the homework afterwards, there's no restrictions. 5-minute massage, 5 times a day for 5 days. In fact, we have another seminar coming up tomorrow at the Waterfront Inn, so if you're out here in the Villages, we'd love to see you there.
Okay.
No downtime, only little pinches with the filler in the cheeks. Very rarely does somebody need Valium or laughing gas. We've got that in my Tampa office. We have the laughing gas, but if you have Valium, you need a driver. So
Right.
most patients don't want that or don't need that. And then I'm going to follow up with Gail in 2 months. And in 2 months, we're going to look at her pictures side by side, and if she's happy, we leave things be. If she wants to add more, we can always add, but this way we're not going to go too far. Now, are you back and forth up north, Gail?
Yes, we are.
When do you head back?
Usually the middle of May.
Okay, so we have a lot of snowbirds that come, best of both worlds, and so we definitely want to make an appointment to follow up before she leaves in May. And even when my snowbirds are out of town, they can call us or reach out at any time if they need anything. We've got a little drip there. So we're accessible if you need us for our out-of-town patients. So we are completely done. Hopefully that wasn't too bad.
No, not at all.
So I like to do that little bit more massage before we wrap things up here. Up, down, side to side, back and forth. You cannot hurt the filler. And this, the massage helps because it helps to reduce some of the swelling. Let me grab a mirror for you. Okay, how does that look so far?
Good.
Make a big smile for me. So as we say, we don't want to taste the chocolate cake before it's done baking. I like the volume. It's going to build the collagen through here. What we see today, it goes away 100%, and then it's going to settle down. So one more time, I want you to take a look so you can see in her pictures the neck, how she improved with the lift, and we want to improve just a little bit more in the cheek there. And very proud of Gail's results. So any questions for me?
No, thank you. Wasn't bad at all.
Very good. You did great. Thank you for watching. We're on a mission to stop bad plastic surgery. We're here to do things the right way. I'm Dr. Rich Castellano. We'll keep you on track. Please share this with a family member or a friend that you know who's thinking about having something done. We will keep you safe. We'll see you in the next video. Very good. Looks really, really good. And we'll get you some ice.
Okay.